somebody who's pathological nature is probably suffering from a personality disorder, which means somewhere along the way they got that way and they're going to stay that way, and there's not a whole lot you're going to do to change their behavior, whether they're murderers or child molesters or people that are going to harm or rob or do other antisocial things towards people. People with OCD recognize that this is abnormal, but it is the anxiety. Remember, OCD is an anxiety disorder. It is anxiety driven. The anxiety drives the obsessive thoughts and the compulsive behaviors. And people with OCD have a change from the way they used to be. So it's not that I've always been. You know, from the time this kid was young, he hurt animals and he set fires and he bullied other people. Those are the people that have the psychopathic, sociopathic kinds of behaviors. And they're probably going to go on in their lives to do antisocial things throughout their lives. They probably don't even get concerned about it. They don't have a conscience, if you will. Their only concern is, if I get caught, I want out of it. I'll never forget when I was a resident, I saw a man in the jail who was in there for hot check writing. And this guy, I was just a resident in training in psychiatry, and this guy, he cried to me. He said, Doc, he said, I am so sorry. And tears were going down his cheek. And, I heard all those people, I robbed them of their money, essentially, with my hot checks. And I've learned not to do that ever again. I won't do that. If you will just help me get through this, I will promise never will I do that again. We got him out of jail, he paid with a hot check, and we never saw him again. I mean, this is a guy that has a personality disorder. He wasn't bothered by his disorder, he was bothered about being in jail and the chance that he might stay in jail, but he didn't really care. But he put on the show. And so people with personality disorders may behave differently, but that's kind of how they're built. As opposed to people with an acute psychiatric disorder who may develop this disorder as an abrupt change or a change over time from the way they've been.